Good evening, everyone. All the faculties, senior faculties here, my friends, and many of the attendees who have joined us to learn about the sarcomas. So, this is a very interesting webinar, and it was initiated by Priyanka Banga, who is also founder of the Sarcoma Cancer Care Foundation. So, as we hear the word sarcoma, it comes to our mind, what is sarcoma? So, the most common question that comes out, is it a cancer? Is it a tumor? Or what does it mean? So my presentation is very basic to just highlight few points, because many a times we get confused when we hear these words as tumor or cancer or sarcoma. So are these all same thing or it is different? So let me just explain that if there is any abnormal growth of tissue or swelling, so it is called a tumor. So tumor does not mean that it is a cancer. It is an abnormal growth. And it may be a benign or it may be a malignant. So what is the difference? Benign means something which is slow growing and usually it does not spread to other parts of the body and is not a life-threatening type of disease. But on the other hand, the malignant ones are like which are aggressive tumors and tend to spread quickly to other parts of the body and can be lethal if not treated properly in time. And most of the times, these require a multidisciplinary approach. So, unlike benign tumors, which sometimes can be just observed without any treatment or may require a surgery, on the other hand, the malignant tumors mostly requires a more massive type of surgery and massive type of resections along with chemotherapy and or radiotherapy. So, some basic facts about sarcomas. So these are very rare tumors. If we compare other type of cancers like oral cancer, breast cancer, lung cancer, so the sarcomas constitute only 2% of all these cancers, the bone and the soft tissue sarcomas. Why they are called sarcoma? Because usually scientifically, these tumors which arise from bone and soft tissue or scientifically from the connective tissue, these are called sarcomas, and so they can be found in any part of the body. It can be seen on the face, it can be seen inside your body in the muscles, from the nerves, from the blood vessels. So it can arise from any part of the soft tissue. If we talk about example, many of our patients must have also joined, so they will be familiar with these names like osteosarcoma or other sarcomas. So when we talk about benign tumors, like I said, the simple way is to know that mostly they are the terminologies from a cyst, uh, bone cyst, aneurysmal bone cyst, or fibrous dysplasia like that. But once it is a malignant, it is mostly the terminology end with a sarcoma, and even we have like osteosarcoma, Ewing sarcoma, chondrosarcoma, and a bit different biological group like chordoma. So why are we here today discussing about all these? So in 1903, the first flight which took off. So nobody had dreamed of how it will go into the future, and you can see the structure how it was bent. And now, if we see today the flights what we have, they are totally developed. They travel faster than the sound of the speed, can take you within minutes here and there. Similarly, in the medical uh, field, and particularly talking about these sarcomas, a lot of things has evolved over the last few decades, and especially if we talk about for last 5 decades, because the advent of chemotherapy, it gained a prominent role somewhere in 1970s. Prior to that, if there was a tumor, any type of tumor, let's talk about a sarcoma in a hand or a foot, it used to get amputated. People would just chop it off and remove it. But still survival was very poor. But over the time, we saw that gradually things improved with the advent of chemotherapy, the survivals improved. And chemotherapy was one of them. Apart from that, we noticed development in the mapping system, like we have now MRI, CT scan, PET scan, PET MRI, which can clearly map the disease, where it is located, which part of the body it is involving, how much bone or soft tissue has to be removed. And so we can preserve the part of the organ, and which is called a limb salvage surgery. The other modalities like radiation therapy previously used to be very simple cobalt therapies, and which progressed to linear accelerators and multi fold improvement in the precision has come over the now. And today, like the webinar is on the role of proton therapy, which is something one of the latest modalities which is used in the treatment. Apart from that, very important improvement has come in the understanding of the biology of these tumors. Before, we used to think that these tumors are only something which is locally a problem, and treating that local problem will solve the disease. But now we know that no, it is a complex interaction at multiple levels, at the cell level, at the biological level, and it also needs to be handled well. That's why uh, we have newer modalities of drugs which can target at very specific points. Another important development is in the field of surgical innovations. Like Professor Mailwan and Natarajan was saying before, in 80s when he started, there was very primitive prosthesis or no prosthesis, but then it led to the development of many indigenous prosthesis, by which we could achieve reconstruction after tumor resection. Prior to that, if we had to resect a tumor, patients would go for amputation because there was no modality to reconstruct that defect. But once you have a reconstruction tool with you, we can do a limb salvage with this prosthesis. And there has been, with the evolution, the cost of these prostheses also have come down, and it is very much in the affordable range of everyone. So if we talk the current situation in sarcomas, in bone cancers or soft tissue cancers, the risk of amputation has gone down drastically. And we are able to achieve limb salvage in more than 90% of the cases, unless it has been contaminated or it is a mismanaged case. Most of the times we are able to do limb salvage procedures. But what it is that has led to the improvement? So actually, it is not just one aspect, but a multimodality approach. Like I said, uh, what is the multimodality approach in the treatment of sarcomas? So we have the advent of these surgical tools, uh, better planning because of the proper imaging, location of the tumors, uh, with the help of precision tools like computer navigation and 3D printing, 3D planning. Then we shrink the tumor with the chemotherapy. We kill all the circulating cells, and uh, especially to kill the other areas where beyond this tumor, where the tumor has gone beyond, we use radiotherapy, especially in situations where we are not able to take out the tumor completely. Radiotherapy has gained a very prominent role in improving the outcomes in terms of prevention of local recurrence as well as improving the survival outcomes. So just a few examples, like this was a case where you can see on my screen on the left side, there was a tumor, which was osteosarcoma of the distal femur. And we know that when we plan treatment, we have to understand the biology of the disease. Some tumors are chemosensitive. Surgery as such is the main modality of treatment to remove the tumor out of the body. But the cells are in circulation. We need to take care of that, for which chemotherapy is given. So in bone tumors, as such, surgery and chemotherapy have a very prominent role, and radiation plays a little bit lower role compared to these. But in soft tissue tumors, most of the high-grade sarcomas require proper radiation, multidisciplinary team with radiation, chemo, and surgery. So here we can see that how we remove the tumor. It is resected out, and this is what we use. And you see the post-operative X-ray. Some other developments in the surgical field, like this case where there was osteosarcoma with a pathological fracture, you can see, and the tumor had contaminated the entire length of the bone. So nowadays we can replace the entire bone with this prosthesis, and this is called a total femur replacement. where we change from the hip to the knee completely. Still evolving, and I would say the evolution where we are modifying that sometimes rather than removing the tumor out of the body, we can sterilize the bone while it is inside the body. And this is the use of cryotherapy. So this is the use of liquid nitrogen in which while the bone is still attached inside the body, we can sterilize this bone and we can put it back by killing all the tumor cells. So something called cryosterilization. In very smaller kids where we cannot use prosthesis or other modalities, so we can have still different types of procedures, and this is called rotation plasty, where we remove the tumor bone like femur, and then the limb is put it back, which is called a rotation plasty because the leg is rotated almost 180-degree. So these are all various innovations, developments in various modalities which have led to successful outcomes. And if we talk about successful outcomes, I would say different studies have quoted different like 5-year survival, which ranges somewhere between 60 to 80% in a good center in a non-metastatic case. By non-metastatic, I mean when the tumor is just localized to one part, it has not gone to other parts of the body. So it has a good fair chance of survival. But still, in some certain situations, there are limitations because as a surgical principle, when we have to remove these cancer cells out of the body, we have to make sure that it is taken out completely. But in some locations, like you see, this is a spine, and we can see these vertebra, and you see that multiple level there is change in the bone, there is some soft tissue component, and behind what you see is the spinal cord, and there is tumor involving that spinal cord also. Similarly, here you see this is our lower part of the spinal cord, which is called sacrum, and which is involved by a tumor called chordoma, which has destroyed the bone completely. In these locations, you cannot remove the tumor completely out of the body. And here, what is very important that we should have a modality with which can kill these cells and achieve cure out of it and improve the local recurrence, improve the overall survival. So I think this presentation and talk will take you through this journey where at one point where we come to a halt where we cannot treat it completely, we have to rely on multimodality approach, and we'll see how the recent advances in the radiation treatment with the proton therapy can help us achieve cure in all these things. So this is our team at Max Institute. This is the East Zone team. We are in total, we are around 100 oncologists, and this is a team from the East Zone, around 50 oncologists. We take care of different organ-specific cancers like breast, head and neck, GI, musculoskeletal, etc.